everyone, and welcome back to another episode with Advanced Behavioral Health Podcast, Making a Difference in Mental Health. I am your host, Danielle Young. We are starting a brand new series. This series really is just about resources. We will be featuring community resources throughout this entire month. All of our guests will be discussing their field of expertise and lending us resources that will help, that will inform, that will educate our audience. And so today we have a very special guest, Ms. Dorne Hill, Senior Administrator for Crisis Intake and Trauma Services for Montgomery County Health and Human Services. She'll be providing us today with some extremely useful information and insight. But before we begin, I got to say hi to my co-host. Hey, Wendy, how you doing?
Hey, Danielle, how are you? I'm super over the moon excited to have my friend, dear friend and colleague join us today so we can talk about resources. Miss Dorne Hill, how are you today?
Hello. I'm good. I'm excited to be here and talk about the services. Thank you so much for having me.
Our pleasure. So we're going to just get right into it. Tell us a little bit about your role in Montgomery County.
Sure. Thanks for having me. My name is Dorne Hill, as Danielle said, and I currently oversee the Montgomery County Crisis Center, which is a 24/7 walk-in facility that sees clients for mental health assessments, behavioral health assessments, domestic violence, and homeless intake into the individual adult shelter. We also have victims of sexual assault program, abused persons program, also access to behavioral health services. So that is the array of services that I oversee as the administrator. We also have 4 residential crisis beds, which are a step down or a diversion from inpatient psychiatric hospitalization. We also have safety net mental health services, where we offer bridge appointments for state insured or uninsured individuals who need to see a psychiatrist and need mental health intervention. And we work with them and get them to providers once we are able to stabilize them. So that's the array of services that I oversee.
Excellent. Dorne, is this a new role for you? Or you've had it for quite some time?
So officially, I've been in this role 4 days, but unofficially I was.
Okay.
Thank you.
Congratulations.
Thank you. But I've been the acting senior administrator in this role for about a year. I've managed through the entire pandemic, and it's been a ride. But yeah, I'm happy to be in this position.
Okay.
And Dorne also has an extensive background in child welfare services.
Absolutely. Yep. I was in child welfare services for 15 years. I also have worked in individual therapy. I've worked in hospitals, emergency rooms, as well as psychiatric units, inpatient units.
So, Ms. Dorne, you've got over a decade in the game here.
Yes. I love it. I love it. I love being a clinician.
Awesome. That's excellent. And so, we really want to know, because we are approaching the new school year, can you tell us, as an overseer or overseeing the behavioral health services at your agency, how is your team actually preparing for the return of students to school?
Right. So that's a great question. So we have an understanding with Montgomery County Public Schools that we've had for years, where if a child is in crisis, suicidal, homicidal, seeing or hearing things, whatever it may be, they make a referral to us for an assessment. So pre-pandemic, we saw approximately 1,800 school referrals a year.
Oh, okay.
And during the pandemic, we were open. We never closed. We're essential workers. So that's another thing I should have mentioned. No matter what, we're always here, 24-hour phone and walk-in service. So we actually started to have a hybrid model to really meet the needs of the school. So we are now offering telehealth crisis assessments. So that way families can keep themselves safe and stay with the other children and not have to, lug in the whole family to our facility. They can call us, and within 15 minutes, they can have an appointment, see a therapist, we can do an assessment, and then, give them some next steps and referrals for the best way to for the best intervention for their needs. So additionally, we're really working to build up our relationship with MCPS, not just from a telehealth standpoint, but also just reminding people that we're here. So we have been doing lots of outreach to PTAs, education with principals and school counselors. We have been, working with the Reimagining School Safety committee that's looking at removing the SROs from the schools and replacing them with, more mental health based providers. So looking how we can support MCPS in that. And also we're increasing our mobile crisis response. So we're going to have satellite offices in Silver Spring and in Germantown. And our role is that we will then be more community based and be able to really acclimate and work with the clusters of school in those communities to give them a, quicker and more in-depth support by being a part of their community.
That's wonderful and so needed because of, just our background in child welfare and where those populations don't have access to services. That's a beautiful idea. I love it. I applaud it that we're going to now be in the community and the schools can now reach out to you and offer those services to everyone in the area. So that's absolutely great.
Absolutely. Yeah, because, we've never felt great. So historically, we've only had one mobile crisis team for a county of over 1 million people. That doesn't even equate, right? So it never felt great to us clinically or safe for us to tell a family or a school that had a crisis with a student or a child, sorry, we can't come right now because we're on another call. So this way, not only can we just be intervention, we're trying to be promotion and prevention as well. So if we're there at the PTA meetings, we're there at the school carnivals, and we're interacting with people and they can reach out to us for consults and we can see the kids and maybe work with the families and get some interventions in there before it becomes a crisis. That's our goal. So we're really just trying to expand upon that, this coming school year. We're hopeful that with kids being in school, we're concerned that kids haven't been seen, right? Normally who would be caught to be depressed or their mood is a little different or they're missing school or they're, they have cuts on their arms or they seem lethargic or all those things that we as clinicians and teachers and, providers look for a mental health crises, right? So we're preparing for an uptick and an increase in children that we see. So we've gotten some extra positions. So we're looking to fill those hopefully as soon as possible so that we can have more people on staff because we want to be available for everyone who needs us.
Excellent. So Dorne, you know that we are still battling COVID-19, especially with this Delta variant that is moving through our communities. How would you, and you guys are considered first responders, your team, first responders or essential workers, as you called it. What are the concerns, if any, for safety for not only your staff, but for your residents and anything that you all are doing to mitigate those factors?
Right. That's a great question because that's been for the last 17, 18 months? Has it been 10 months? It feels like forever.
It feels like forever, but it's been about 18 months.
Okay. So 18 months. So the balance has always been safety and service, right? So balancing that we are here to serve. We are county employees. We are here for the community and we're crisis workers, right? And a pandemic is a crisis. Yes, it's a public health crisis, but it's also become a mental health crisis, which we know who are in the profession. We're seeing the impacts of being isolated, being scared, the news cycle. You mix all of that in the pandemic, political, racial unrest, and it's overload. It's emotional overload. So being in the helping profession, having to balance your own fears, but still being of service and caring about your community has been, I think, one of the hardest things to balance. So we definitely have had, when it first started, N95s and shields and booties and hair covers and gloves. And, even when we're doing mobile crisis, we do a COVID screen for the household before we go out. We do COVID screens of the employees and of any clients that come through the door before we let them pass, the glass lobby, just to make sure that we're not, having an impact that would shut down our service, because we work very closely together. So if one of us or two of us were exposed and then we came and sat with the rest, that could take out a whole shift of people. So we really had to be diligent about wearing masks, Lysol, wiping desk in and out, hand sanitizer. I called myself the mask police, because that's what we've been to each other and the customers for the last 18 months. Like, cover your nose. Oh, please, here's a mask. We have masks everywhere and sanitizer, and but just remembering that we're here for service, and that even the least of these still needs us. So So stacking our cars and not only our own clinical bag, but our physical bag, having masks, having water, having sanitizer, offering to, can we meet outside? Like, I'm going to come, but can we stand outside if the weather's permitting? Really finding other ways that we alternate to be there and be supportive of the community, but also keep ourselves safe.
So important. So important. Thank you for that.
Sure.
Yeah, Dorne, I really like how you pretty much broke down the concept of the balance of safety and service. And, you also really touched on some of the things that even we as clinicians with advanced behavioral health, we're either seeing or we have a desire for there to be, like you said, that balance of safety and of health. And so, of course, we work via telehealth, but we're also going to possibly be shifting and moving back into the space of person-to-person contact. And we still want to be able to provide services, mental health services, all while being safe. And, you actually touched on a couple of other things when it comes to the next question that we were going to ask you about what you're seeing. What is the impact? And you did speak about isolation. You spoke about fear. You spoke about just the past impacts of the political and racial injustices and unrest over the past year. And then there is the emotional overload. And so you did say that, and you did touch on it, but have you seen any increase in behavioral symptoms, or has your team seen any increase in behavioral symptoms from the communities that you serve, or from the students that you serve, from the parents that you serve, from families that you serve? Have there been any increases? And I'll just say this too, because there is this phenomena of the COVID effect. And so whereas we might not have seen clients, in my case, students who had declined in grades because they're home, we might not have seen that before. And because of that, there is an increase of anxiety or an increase of depression. Whereas these were pre-COVID, they were not symptomatic. Have you seen any changes or differences or something new from your team or from yourself with the community that you serve?
Absolutely. We've seen a huge increase in domestic violence lethality. People are more isolated, like I said. So also we've seen a higher number of substance abuse and misuse, and people who are suicidal or psychotic with no history. Like, I'm talking about adults, like middle-aged adults with no history of mental health diagnoses, totally psychotic and suicidal. And it's concerning. The acuity level of the people that we're serving is greater, and that's across the lifespan. Teenagers have had a hard time, man, being isolated, not being able to talk to their friends. I mean, their friends and their social, it means that's their world. So it's the same impact. Like, some people who are single, don't have kids, don't have pets, their only outlet to humans or people was work or the gym, right? Or like going out to eat with friends. All of that was gone, and they were just isolated, like in their house. And yes, we've seen a tremendous increase in domestic violence, substance abuse and misuse, and psychosis and suicidality.
So I can imagine that since quarantining, your services have gotten much busier, and there has been a more like an increase of a need for services. I can only imagine that.
Oh, absolutely.
like over COVID? Did you see it increasing, or is it like increasing now because we're in another shift and there's the Delta variant? So
so our service is really, of course, like last March through like May, it was, it was very scarce because people, I mean, of course, everybody was terrified. Nobody was leaving their house.
Right.
People weren't going anywhere. So I would say come about January of 2021, we started seeing an increase, and we started seeing the acuity. And then since like March, it has just skyrocketed. Our numbers have like doubled in the number of mobile crisis responses and in our walk-ins that we're seeing. So I think, like I said, I think the longevity of the situation has just taken a toll.
Right. And we've seen similar things you just discussed with our clients. We mainly service, children and adults and adolescents, but focusing on adolescents, school-age kids. We did a whole series about COVID-19 and education, and, had a guest on to talk about it from a kid's perspective, like what it felt like as a child to be graduating through COVID, starting college in COVID, being in middle school in COVID, all the norms you missed. And we saw that some of the kids who never, ever were symptomatic in their life, no history of anything, presenting with cutting and depression and anxiety and suicidality. And it was just really intense for us to see that. And trying to get the parents to understand why this is happening. That was the second challenge.
Right. I get it. Yeah, and that's the other thing, like I also think a part of why the numbers increased is because people started getting vaccinated, restrictions started being lifted. So people were more engaged with others. So people were able to see like, wait now, Wendy, like I haven't seen you in about a year, but this is the way you're acting and talking doesn't fit with your baseline and who you are. So we also think, because we're seeing a lot of family and friends bring people to us, and we think that's also, what's impacted the increase. And the need is that people are actually congregating again, so that people can actually see, oh, you're not making sense, or you're not seeming very well. Let's get some help.
Right. And Dorne, throughout our several series that we have had, we did not really discuss what will this cohort of people look like maybe in about 10 years, or maybe what would the data show in 10 years? Was this just a phenomena that happened during this period of time? Will it impact everyone from this point and then over the next 10 years? I mean, even think about the way that we socialize. Will the mask be a barrier, or will this be something that, is something that's normalized? Will we crave and desire more person-to-person contact? Will this virtual setting that we have for socialization, will this become the norm? Will those symptoms continue to increase for those who were not symptomatic before? What will mental health treatment look like moving forward? So you bring up so many different things. And before we swing back over to Wendy, I also like the fact that your agency does provide that psychoeducation for individuals and for families and for other groups, so that they are educated about mental health and even the impact of COVID, on top of symptoms and issues and challenges, stressors, traumas that are already there, to provide more information and resources for those families. So I really love this information that you're providing and so much insight today. What are your thoughts, Wendy?
Absolutely. I think it would be, it's absolutely helpful for our audience to hear all the good things, all the good works that are being done around mental health, behavioral health in Montgomery County. And, Danielle and I like to end on a positive note. We like to always have our guests tell us, what are some tips that you would tell your MoCo residents, or what is it that you want them to walk away with knowing about behavioral health services in Montgomery County?
That we are here 24/7. We're open, available. Anybody can call, even if you're a provider or a clinician yourself and you have a concern for one of your clients and you want to consult, whatever it may be. We're here 24/7, 240-777-4000. And I want to know that there's always help. And regardless of what may have happened before or what your experience was, we're really trying to change and be a change agent in the mental health and in our community. And like I said, really be there and be a part of the community and not just reactive. So
Absolutely.
We're here and we have so many services, and reach out.
Thank you for that. ABH is always wanting to partner with our colleagues in mental health. And so have a site, as you know, in Montgomery County, and we are always willing and able to consult with you and your team and partner so that we can serve our residents and provide them with what they need to stay safe and healthy.
We are really excited about that partnership and really value the work that you guys are able to do with some of the clients that we refer.
Thank you so much for that. What do you think, Danielle?
I have enjoyed this interview and this conversation because it's providing information, it's providing education, it's providing a resource. And it's also allowing for our audience, for our listeners to have a space and a place to go to. Just to wrap up what Dorne has already said about her agency, that it is a 24/7 service. So there is the telehealth option. There's a hybrid option of either telehealth or walk-in services. Dorne has already spoken about building up the relationships with other local agencies and partnerships. Dorne's company has outreach services. And then also we even spoke about schools, and we even spoke about making that greater connection with the school. They have community-based services. And I wrote this down. Dorne said they want to be the change agent. And I think that's what our audience needs to hear, especially for those who are seeking the services that Montgomery County provides. And so, Ms. Dorne Hill, we thank you so much for coming today. It's always nice to meet a colleague of Ms. Wendy Grier, my co-host. And this has just been really a good conversation. It's also great to hear from other clinicians' perspectives and other persons within the child welfare realm.
Absolutely.
To hear different perspectives and different populations that you work with that I might not work with, or Wendy might not work with, or that our audience actually may be a part of. And so it's good to hear that there are services out there for you.
Absolutely.
So, if you could, for us one more time, could you provide that telephone number and a website? What we'll try to do is at the end of the cast, we'll try to have that information. Since this will be posted for visual purposes, we'll try to have that information at the end of the cast. So if you can give this to us one more time, and then I'm going to turn it back over to Wendy to let us know what's coming up next.
Sure. That number is 240-777-4000. And we are open 24/7.
Excellent.
We so appreciate you. We appreciate your role in the county, and we continue to look forward to partnering with you. So Danielle, as we continue this series, we're going to have our medical director back, who is Dr. Leslie Ball. Yes, Dr. Ball wants to talk about suicide prevention, because September is Suicide Prevention Month. So she has a lot to tell our audience, a lot to share with us. So I'm excited to see her come back on our show.
Excellent. And I'm sure we'll have more resources to come. So we ask all of you to stay tuned. My name is Danielle Young with my co-host Wendy Grier. This is Advanced Behavioral Health Podcast, making a difference in mental health, where we're striving to make a difference in mental health. We will see you next time.